Hi, guys, and welcome. Hi, Dr. Andy. Thank you so much for joining us
Hi there.
today.
No
So,
problem.
today
Thank you for inviting me.
I'm really happy to have you. This is a great, very relevant topic for us to be talking about today. So, today we're talking about musculoskeletal adverse events associated with Librela use. If you guys are joining us live, thank you for joining us. It's really good to have you. Please feel free to ask any questions and join the conversation. That is essentially why we are live with you, so that you can join the conversation with us. Okay, so Dr. Andy is from Greenside Regenerative Therapies and Rehabilitation in the UK. And before we kind of get into it, can you please introduce yourself and share a little bit about the journey that brought you to this topic of adverse events associated with Librela use, and why that is what you want to discuss with us today?
Okay, for sure. So, yeah, I'm Andy. I work at Greenside Referrals based in the Scottish Borders, where we deal with a lot of musculoskeletal conditions. So we do a lot of treatments with regenerative medicine and orthobiologics, and a lot of rehabilitation as well. So we're a referral practice, and we have on-site physiotherapy and hydrotherapy as well. And we've got a team of 3 vets here. And yeah, pretty much 100% of our time we're dealing with musculoskeletal conditions. We were the first referral center to open up in regenerative medicine, and we did that about 13 years ago. So we've been using stem cell therapy and PRP treatments for a long time now, and have a lot of experience. And I guess this is how I ended up becoming interested in Librela as a treatment option. And I guess historically, we see a lot of patients with end stage arthritis, because we tend to be the referrals tend to be owner led, and we see a lot of end stage disease. So a lot of our patients are coming to us as a last resort. So they've had the drug therapy, they've had the rehab, they may have had surgery, and they're still not improving. So the owners explore different options for treatment, come across stem cells, and then come across us, and then come to see us for help and treatment. So I would really like to be involved in early disease process, at the time of diagnosis, but it's just the way it is. We tend to be used as a last resort, and we can get some fantastic responses. So we do tend to see the worst of the worst, and we get referrals from all over the UK, as well as from Europe as well. So we see animals from a very wide area. So about 3 or 4 years ago, I started seeing a shift in findings when we started examining these dogs. And I guess a lot of my work is Labradors, and a lot of my work is elbow dysplasia and advanced arthritis associated with elbow dysplasia, and that accounts for probably 70% of my caseload. So we started to see cases that were really struggling, and when we come to do the diagnostics, so take x-rays, we were seeing some really severe arthritis, and this started happening all of a sudden. So I saw one case, and you take the x-rays and you're like, gosh, this is severe. And then the next week I saw another case, take x-rays, you're like, what's going on here? And all of a sudden I started thinking, this isn't arthritis that I'm seeing. This is And I've seen some pretty end stage arthritis joints, just because of our caseload. But there was things on the x-rays that, cancer comes to mind, other conditions. There was all this bony proliferation. And then, yeah, it just kept going, and I kept seeing case after case after case, of all these radiographic abnormalities, and patients really struggling. And the common theme was these patients had been given Librela. In most cases, they had improved on the Librela and then started to deteriorate again. And hence that's why they came to see me. And then we're x-raying and seeing these abnormal x-rays. So that led me to start reporting these cases to Zoetis and the VMD. And I felt that it wasn't being recognized in primary care practice as a problem. Mike Farrell's paper that was published a few years ago now certainly raised a lot of awareness, and I did a poster presentation at the Veterinary Osteoarthritis Alliance conference in 2025, where we showed these x-rays, and we tried to sort of classify what we were seeing, and so to raise awareness. And it was at that conference, and because of my poster presentation, that Zoetis were there, and so were the VMD actually, and both of them were very interested in this. And Zoetis asked me to publish this, which it's taken me some time, but I have recently published a paper on the identification and possible pathogenesis of Librela induced adverse events, and that was published in April in Companion Journal. So that's how I've sort of become involved in this. And some weeks we're seeing 3 cases a week of this, so it's something that we're seeing a lot of. And I guess it's because of the work that we do. These cases are sort of funneled to us because it's the worst of the worst, so we're getting an over representation. Certainly speaking to primary care vets, they are not seeing it as frequently or not aware of it. So my goal is to raise awareness.
Okay. So to
Sorry,
everyone
that was
that's
a
joined
long
us live, no,
introduction.
it's very good. Thank you. So I already have comments coming through. Hi guys, it's so good to have you with us. We are going to take questions at the end, but please feel free to post them. We are here to have a conversation with you as a professional community. Let's talk about this. Dr. Andy, you've prepared a presentation so that we can really visually see what is going on. Will you pull that up for us? And then we'll go through that presentation so we can see these x-rays, we can see what this looks like, and then we will discuss and ask questions at the end. Okay, guys, thank you so much for joining us. All right, I'm gonna pop that up onto the stage. I think we're still seeing a mirroring, there. Can you go into presenter mode?
How's that?
No, we're still seeing your whole screen shared. So I'm going to just pull that off again. I think,
right.
Can you start the screen share? Yeah, again.
I'll do that again, because as soon as I bring up the slides, I can't see you and I can't see what I'm sharing.
Perfect.
Allow to share window.
All right, so while you are pulling that up, guys, it's really good to have you live with us. There we go, I can see that. Okay.
Okay, is that working?
That's working. That looks perfect. Please take us through your findings.
No problem. So I can't see you now. So if something goes wrong, let me know.
I
So
will use
yeah,
my
this is
voice.
okay. So this is just a few slides I put together because I think you really need to see these changes to appreciate it. So although this is a Facebook Live, I think it's important that we can see what we're talking about. So Librela is a anti-NGF monoclonal antibody. So basically, it interferes with and blocks NGF, which is involved in the pain response. So it's a new type of drug. It's an antibody treatment. But it's not necessarily new. First of all, it was developed as a treatment option for osteoarthritis in people. So back in 2011, I think, this was going through clinical trials in humans for osteoarthritis. And so it was an anti-NGF monoclonal antibody. And what they found in the stage 3 clinical trials is that in a proportion of patients were developing worsening of their arthritis, and it was classified as rapidly progressive osteoarthritis. So the human treatment was not granted authorization for use, and further work on it was stopped. So basically, then more recently, this Librela has come around and for the use in dogs, and as I say, since its release in 2022, probably at the end of 2022, beginning of 2023 was when I started to see a lot of adverse events showing up for musculoskeletal problems. So the difficulty is Librela is a good painkiller, and that may mask problems. So we can get severe joint degeneration, and the animal might not show obvious evidence of lameness initially, but once that does start to show, then we've normally got some severe problems developing. So I just want to go through what I'm seeing. So there's basically two sort of broad musculoskeletal problems that we see, and as a adverse event secondary to Librela administration, and this has been addressed in Mike Farrell's paper, and also in my paper. So we can see this rapidly progressive joint destruction similar to what was seen in humans. And this can occur quite acutely, where we get joint collapse, subluxation, we can get fractures. All of a sudden, we're seeing fractures in elbows, intercondylar fractures that weren't in spaniels. So certainly breeds not predisposed to it, and these were generally non-traumatic. So just to be clear, I'm not seeing those cases because, if a dog has a bone fracture or a joint collapse, this is a surgical option. They're sent to an orthopedic surgeon. They certainly don't come to me for regenerative medicine. That wouldn't be appropriate. So I'm seeing a more sort of insidious problem that seems to occur after being on the Librela for 6 months or more, whereas these acute problems can occur after 1 or 2 treatments. So if I can just bring up a laser pointer here. So on the right here, we've got an elbow here, an AP view, where we can see that this is not normal osteoarthritis. We're getting this massive development of new bone formation all around the joint. And I guess what's most important is it's not, there's the joint itself, it's extending well away from the joint. And this was what was very unusual. So for these more insidious cases that I'm seeing without collapse or fracture, so I guess in dogs that where the joints don't collapse, this is how they progress. We get these extensive osteophyte formation, but in addition to that, we also get what I've termed Stegosaurus exostosis. So this is new bone formation coming from the periosteum, and this looks like the dorsal spinous processes of Stegosaurus skeleton. So hence the naming of it there. And these tend to form well away from the joint and extend down the diaphysis of the bone. We also see these radiographic popcorn type lesions, which I think is a result of chondroosseous metaplasia. We'll come on to that. But I also see calcification in the soft tissues, something that's called heterotopic mineralization. So that just means mineralized tissues, mineralized soft tissues where mineralization shouldn't be present. So these popcorn lesions, because it looks like radiographic popcorn, this is the classic sort of appearance that I'm seeing over and over again in these elbow joints, where we get a lot of mineralization where it shouldn't be, you know, the joints down here. And the other thing with elbow dysplasia, most of the pathology is in the medial compartment. So we tend to see the arthritis worse medially before extending in the whole joint. With these Librela elbows, we see a lot of changes on the lateral aspect, which is another unusual change. But here we can see that we've got all this what looks like popcorn. So this is chondroosseous metaplasia. So it's soft tissues turning into bone, and this bone has bone marrow in it, so it's got cortical and bone marrow, but it's in an abnormal location. That's why we get the radiographic appearance. So this dog presented to me. She was a 10-year-old Labrador, and she had elbow dysplasia and osteoarthritis. And she had been receiving Librela for about 1.5 years, and she was initially did well, but then deteriorated. So the owners were looking for other options. I think they tried to increase the dose of the Librela or the dosing frequency, and there was no improvement. So she ended up coming to me, and these are x-rays of her elbows here, and we can see these very atypical osteoarthritic changes and all these popcorn lesions. So these bits you could actually feel around the joint, and they were mobile, and they were actually uncomfortable when you move them. So if you can imagine a joint full up with little stones in this fibrous bag, and the fibrous bag, the joint capsule that's pushing these stones onto the bone, every time that elbow moves, they're just grinding away and causing a lot of discomfort. So I actually went for surgical removal of these. So we took them out, and this is what they look like. This is them coming out the elbow, and it was like a bunch of grapes. And these very hard calcified nodules were all coalescing, and they had a very thin fibrous stalk, almost looking like a little blood vessel that attached it from the synovium. So it was originating from the joint capsule, the synovium, but forming these bunches of pebbles of bone. And I sent these off for histopathology, and it came back as chondroosseous metaplasia. So these nodules were actual bones. We had cortical bone, then we had bone marrow in the middle with bone marrow adipose tissue, and a very dense connective tissue sort of capsule on the outside. So histologically, this was new bone formation, but obviously it shouldn't be happening where it was. So again, here we've got it close up. You can see these sort of bunch of grapes and these hard bits of new bone formation. So this is what looks like the popcorn on the X-rays. So prior to Librela, I can remember one case that had chondro-osseous metaplasia in probably my whole career. So it's not a common thing. It can occur, but it's not common. And all of a sudden, I was seeing 2-3 cases a week of this. The other radiographic findings, going back to our Stegosaurus skeleton, we've got these big dorsal plates. And this is what the radiographs remind me of. So this is another elbow, and we've got these projections, this exostosis, new bone formation coming from the cortical bone, well away from the joint. And here's the other view, and we can see these very jaggy, spiky bits of new bone that certainly isn't seen in normal osteoarthritis. And then we get heterotopic mineralization. So this dog's got a bit of popcorn and it's got mineralization in the soft tissues. So here we've got collateral ligament that's becoming mineralized. This is a carpus here. So this is mineralization of the pollicus longus insertion in this dog, and we can see that the digits are also affected. So we can see on the metacarpal bones here, we've got this mini Stegosaurus type changes going along way away from the joints themselves. Although the joints are affected, we're getting this cortical new bone production. So as I say, most of my work is elbows, so I see a lot of elbows, but it does occur in other joints as well. This dog was a 4-year-old Labrador again that was radiographed here on the left by their primary care veterinary surgeons, and was diagnosed with early arthritis associated with elbow dysplasia. And this dog was started on Librela, and it did well for 18 months. And then all of a sudden the elbows dramatically enlarged. The dog became painful and very lame, and came to me, and we x-rayed it, and then we can see what we've got now. So going from these x-rays on the left with mild OA to this point is in 2 years. And arthritis progression, it hasn't really been defined, but we wouldn't expect it to look like that in 2 years. And this is what we've got. And again, all these popcorn lesions, all this new bone formation, heterotopic mineralization, flexor enthesiopathies, ligament calcifications. As I say, it's not just related to the elbows. We see it in hocks very commonly. So this hock has got all this excessive bone production. We're getting these jaggedy areas of new bone formation. And this dog actually went on to have a subluxation of its of one of its tarsal bones. Here in the digits, we get all this mineralization in the collateral ligaments and popcorn lesions. And then as well, we can see new bone formation on the cortical bone running up the digits. This hock very swollen, a lot of soft tissue swelling around that, and heterotopic mineralization and popcorn lesions. So yeah, we see it in the digits. We see carpi and hocks very commonly. We see it in stifle joints, especially if they've had surgery. So I think that the real problem for me is when I see these dogs, I'm taking x-rays, but I've got nothing to compare it to. So it I think what we need to do, certainly in primary care, when we're diagnosing osteoarthritis, it's really important to get imaging done so that we can confirm the diagnosis. And we've got a starting point that we can look at, because if I'm taking x-rays and I've got nothing to compare it to, we can't see the speed or the extent of that progression. And I think what's happening, these dogs are getting Librela, they're initially doing well, then they're not, and maybe being x-rayed, and then what you're seeing on x-ray, I think some people are saying, well, this is severe arthritis, no wonder the dog's not getting better. But maybe it isn't just progression of arthritis. Maybe it's something that's happening because of the Librela administration. So I think it's really important that we raise awareness of this, and I think dogs that are receiving Librela need to be monitored and have repeat x-rays taken, in an ideal world, every 3 to 6 months on being on treatment, to look for early signs. I think for physical therapists, you're in a great position to monitor for changes, because you're measuring range of motion, you're looking for joint swelling and things, and you can maybe pick that up sooner and refer back to the vet if you've got concerns. So range of motion tracking, we can monitor that over time, and with these dogs we see a rapid deterioration in the range of motion in the joints as the soft tissues become mineralized and affect range of motion. One of the biggest adverse, or the most commonly reported adverse events of Librela is lack of efficacy, or was initially working and then stopped working. So this is an adverse event and should be reported to the VMD if this occurs, but that should also prompt you to ask, why is it no longer working, or why isn't it providing pain relief? Have we got something else going on? Have we got a diagnosis of arthritis and it's not, or have we got problems happening? So hence that's going back to appropriate monitoring and diagnosis, including imaging. So managing these dogs is very difficult. Obviously, if we've had fractures or joint collapse, then we're looking at joint replacements, amputations, even euthanasia of these dogs if we've got bilateral problems. Some referral surgeons are not willing to operate on these dogs if they're on Librela because of changes in bone healing and complications with surgery due to the state of the surrounding bone around these joints. If we're seeing these problems, for sure, we need to stop the Librela, but that, in my experience, does not reverse these changes. So once they're present, it doesn't go away. I've been using regenerative medicine, so stem cells, PRP, in combination with shockwave therapy, and I'm getting some success in treating these cases. Obviously not for fracture or joint collapse, but where we get these more insidious calcification events. But you know, these dogs are not responding as well to this modality as a normal arthritic joint would. So I'm collecting data on that, and about to publish about 40 cases that I've treated using regenerative medicine and shockwave. But we just need to raise awareness and make sure, if we've got any concerns, that we report this, because we don't know the true incidence of this. I see a lot of it, so I'm really concerned about it, but that's because these cases are being funneled into me. but my concern is that it is being missed in practice. So yeah, that's something that we need to find, is how common this is, and we can only do that if any concerns are reported, and the Zoetis are actually receptive of this and will follow this up. I have got a little quiz here, but I think for time we can just skip through that. But this is the paper I was talking about earlier that published a couple of months ago, and certainly have a look at that. That summarizes this presentation and looks at how Librela potentially could, result in these musculoskeletal adverse events, but obviously there's a lot of research still required in that. So that brings us to the end of that.
Thank you so much for sharing that. It's very interesting to see it visually. Yeah, these changes. So I do have a few questions, and we do have a few questions from our audience, which is great.
Sure.
Where to start?
Where do we start?
This is hard to talk about because I think I always try to not bring a bias one way or another into a conversation like this. And when we're seeing adverse events like this, it's very difficult to remain unbiased. And honestly, as you were talking, I was really questioning myself. Should I be unbiased, or should I just say, like, I don't like this? We shouldn't be okay with this level of adverse events. These dogs are not surviving these adverse events, right? Like, most often this is resulting in euthanasia, because where do you go from there? And if we're saying that 4-year-old Labradors with beginning early degrees of arthritis, and then within 2 years they're sitting with such bad deterioration, that where do they go from there as 6-year-olds? So okay, so my first question is, I have never seen radiographs like this associated with anything else. Is that right? Are there other conditions where we're going to see bony changes like this, or are these changes really specific to Librela use?
So yeah, I mean that's I think they are pretty specific, yeah, and that's why when I first started seeing this, you initially think, oh, that's terrible arthritis, and then you're like, no, that's not arthritis. It doesn't look like that. And certainly for this Stegosaurus exostosis, I'm not seeing that in any other condition. These popcorn lesions, as I say, I've seen one case of actual chondrosseous metaplasia, and that was in a flat coat retriever many years ago in its stifle, and it was associated with early cruciate disease, and it developed that. But that's one case. So yeah, it potentially can occur as a naturally occurring pathology, but it's not common. And yeah, mineralizing enthesiopathies and tendinopathies, yes, it can occur, but it's normally one tendon. So we see a lot of supraspinatus enthesiopathy, which is mineralized, but Librela doesn't seem to do that to the supraspinatus, but it does do it where there's potential instability in an elbow, and we get all this collateral ligament damage and mineralization and things. So yeah, and I think that's the whole point of my paper, is that these are new findings, and it is rarely seen in a normal arthritic joint. You start to question bone cancer, but that doesn't cross a joint. There's a condition called Mary's disease, hypertrophic osteopathy, where if you have a mass in the chest, it can result in bony proliferation. So on the diaphysis of the bone, and but it doesn't really look like that either. So I think to me it's quite classic signs, and I would say I can look at an X-ray without looking at the dog or having any history and tell you whether that dog has received Librela or not. That's how confident I am.
Oh, okay. Let's pull up some of these questions. So Helena asks, do these changes only occur in the joints that originally had the osteoarthritis?
No. So I think it occurs in joints that have pathology, but that pathology may not have been, it may have been clinically silent. So, you know, I've seen dogs that have had elbow issues, started on Librela, and you know, no other musculoskeletal condition was diagnosed at the time, and then yeah, 6-12 months later it's hocks, collapse, swell up and collapse. And so yes, we can see it in what's called off-target joint. So where we're treating osteoarthritis in one joint and it can occur in the other. I see it very commonly in that scenario in the digits, hocks and carpi, most commonly. And yeah, certainly in I feel like there's got to be some, that joint wasn't perfectly normal, so it may have had some early instability or early arthritis, and then the Librela makes that worse, but it wasn't clinically there, because you know, we're not getting a dog with elbow adverse events and then every single joint in its body is affected. It's strange in that respect.
Okay, cool. From Carol Ann, are older dogs more likely to experience these side effects, or does it affect all ages equally?
It affects all ages equally. I see it in, you know, young dogs and old dogs. It's seems to be the time on that they've been receiving Librela, not their actual age.
Okay. Are you aware of any independent reports on the bone and joint findings from the necropsy reports on the laboratory beagles?
Is that referring to the initial studies done for authorization? Because the initial trials of Bedinvetmab was done on young beagles, and they did do so I think there was histopathology done on the joints in these dogs, but they'd only been treated with Librela for 6 months, I think, and there was some questionable pathology on 1 or 2 of the dogs involved in that study, but it was dismissed, I think, as a problem. So certainly I'm starting to do histopathology on these cases myself. That one that shows you where we removed those pebbles from the joint, you know, sent that way for histopathology. I've got another case that had severe elbow problems, and as a result of elbow dysplasia, he had advanced arthritis, was started on Librela, and his whole elbows just calcified, and then he was walking down the road and his elbow just fractured, just walking on the lead, nothing traumatic, just collapsed, and his elbow intra-articular fracture through the ulna, and I could not find an orthopedic surgeon that would repair it. So we sent the radiographs to four surgeons to see how they would repair it, and the changes in the bone were so severe that they didn't recommend surgery. Amputation was an option, but the owner, well, I wouldn't have done that because the other elbow was just as bad, and I think that would have fractured itself. So we treated that dog conservatively, and he did well. Actually, the joint actually fused eventually, but the owner wanted me to send his elbows away for histopathology when he was no longer with us, and that happened a few months ago. We put him to sleep because we couldn't control his pain, and we sent the both elbows, the entire joints, off for analysis. So that was nearly 3 months ago, and what I can tell you is that they're only just able to start processing and looking at the soft tissues associated with the elbows, because it's taken over 2 months to decalcify those tissues. So when you're looking for histopathology, I want to know what's going on in the tendons, in the joint, and things like that. But you have to take away the bone, the calcium. So you decalcify the tissues, and that normally takes 1 to 2 weeks, maybe 3 weeks to dissolve a whole bone, so that you can do histopathology on it. And this case, and the histopathologist hasn't seen anything like this, and it's just like 2 months it's been decalcifying, and we're still not fully there. So that just shows you the amount of mineralization that was occurring in and around that joint and all the soft tissues. So I'm waiting on the histopath for that. I think that'd be quite interesting. I don't know whether that answers the question.
I think it does. Denise does say yes, the Beagle study. So
Yes.
I think you were on the right one there. Jane is keen to know if you're seeing the same problems with cats on Silencia.
So I am not, because unfortunately we don't see many cats. We have treated a few. I'd love to treat more cats. We just don't get them referred to us. But I've been in communication with a lot of orthopedic surgeons in America now, and we're working together on several publications. And yes, I've seen some X-rays from cats that have been on Silencia and seen hocks that look very similar to the dogs, with a severe soft tissue swelling with this Stegosaurus exostosis and hock collapse. So yes, it is being seen. Me personally, no, but other orthopedic surgeons are, for sure.
Okay, so Debbie is asking about the human version, and that's a question that I had as well. Is, can you kind of take us through how was this drug rejected for humans and then approved for animal use? How did that work? And is that a failure of the system? How could that be possible, that it's rejected for use in humans and then approved for use in animals?
That's a very good question, and a question that I ask as well. So for human drugs, there is a lot more rigorous process. So it's a bit more lenient in animals. So the human anti-NGF antibody treatment, as I say, was causing rapidly progressive arthritis in a proportion of cases. They found that if it was given in combination with non-steroidals, that was maybe a risk factor, but it was also seen in patients that weren't receiving non-steroidals, and that's why it didn't get through the phase 3 trials. And they found that the incidence of joint replacement went up dramatically on patients that had received the human form. So that should give you information that you would want to investigate if you was going to do this in another species. And I think when it was when it was tested in rats and rabbits as well, there's some studies that show, yes, similar changes where we get joint destruction. There was a rabbit study with cruciate transection to stimulate arthritis, and certainly in rodents as well. So, you know, it would be common sense to think, yes, we should expect this. And then it went through market authorization in the veterinary field, and there was the study was looking at young healthy beagles. I forget how many there were, but they were only monitored for 6 months of treatment. So I think that is with the licensing of veterinary medicines, it is a bit more lenient than the human side, but that's not my area of expertise. But you know, if I was developing this, I would look at, you know, what was happening in other species and maybe design my experiments a bit better to ensure that it wasn't going to happen in our target species.
Because one of the issues has been that, you know, these, as you say, these side effects are not necessarily unexpected from the data that we have.
Yeah.
But what happened is the drug was released and brought into the market, and primary care veterinarians were not educated on proper screening, the risks of side effects. They had no idea, and they were just giving this miracle drug without monitoring the patients, without being aware of what could go wrong. I think that is concerning.
At Greenside, as a practice, we were one of the early users of Librela, and when I first started using it, I was like, this is brilliant. Great pain relief, you know, reportedly no side effects. You know, particularly for these dogs that are sensitive to non-steroidals and things like that, I was like, this is brilliant. But then very quickly, these dogs were coming back with big swollen elbows, but the owner's like, they're doing great, and I'm like, but why have we got a joint effusion? They're drinking a lot, they're urinating a lot, and becoming incontinent, and then they start getting wobbly, and then, you know, all these other things, behavioral change, things I started noticing, and then we start seeing the more insidious joint changes. So I think it was, you know, now the drug is being used, and it is being used widely. We're seeing this, and I think in America it's becoming more and more recognized because they were a year behind the UK, so they're just starting to wake up to the fact that they're seeing a lot of adverse events now, a bit delayed from us because we had it a year earlier to them.
Okay. So I very much appreciate that you kind of started this conversation by highlighting your case bias, right? Patients with end-stage osteoarthritis are coming to you. The patients that have been on Librela for a long time and then are having these really severe adverse events, they're the ones that are coming to you. So those are the cases that you're seeing. I appreciate that you shared that. I do want to highlight, I kind of went through our professional community before this discussion to just see what others have been saying. And there are many other side effects, right? We're not just looking at the joint, the strange development of metaplasia in the joints. We're also seeing restlessness, changes in sleep, urinary incontinence, dogs that feel so good that all of a sudden they do something ridiculous and then hurt themselves in another area. That's a super common thing that's happening. Neurological deterioration is another very big concern that comes up. Are there other things that you're aware of, other adverse events that we should also be aware of and thinking of?
I mean, I'm probably not the best one to answer that because, as I say, it's mainly musculoskeletal problems that I'm seeing, but yeah, certainly cognitive decline and behavioral change. I've had dogs with weird noise phobias, aversion to metal food bowls. What's going
Wow.
on there? So the dog refused to eat. Labrador refused to eat from a metal food bowl. Give it a plastic or a ceramic one, no problem. And that was started after Librela, and resolved when we discontinued the Librela. So in theory, it shouldn't cross the blood-brain barrier. It shouldn't cause any problems within the central nervous system, but it does. And I see dogs that get very depressed on it, and that reverses after the Librela has been discontinued. So the main things that I see and reported is increased thirst, urination, incontinence, ataxia, neurological, like they present almost like in a vertebral disc protrusion, but may not have proprioceptive deficits, weird behavioral change, restlessness, as you say, lack of efficacy. That is the most commonly reported adverse event. That is lack of efficacy. And why is that? Is it because you're causing other problems, and that's why it's not working? So yeah, there's a whole, and if you look at the Librela Experiences Facebook group, there's thousands of people on there reporting all sorts of potential problems. It's difficult because, especially in older dogs where you've got a lot of comorbidities, it's difficult to say, was it definitely Librela that caused that, or would it have happened anyway? It's very difficult to pick that apart, but certainly there seems to be a common theme, going through these. Seizures is another one.
Okay. Okay. So my next, I think we should start to bring this together. And we do have a few questions here about screening and kind of best practice in use. So instead of pulling those up onto the screen, can you share with us what is the screening process we should, or veterinarians should be going through before using Librela, and what is kind of best practice right now to avoid these adverse events, if we can?
I mean, that is very difficult. What is best practice? I mean, we need more information, and we need to know the true incidence of this. We need to know what predisposing factors there are, to be able to guide us. I think certainly before. I mean, I haven't given an injection of Librela in over 2 years myself because of my concerns. But I think, yeah, certainly informed consent. So we need to be discussing this with the owner and advising them that there is potential side effects, and we don't know the probability of that, and we don't know which situations we should or should not use it in yet. So it's very difficult, and until we know that, it is very difficult to advise. So I think it's very important to, before we start using Librela, is we use it for arthritis. So we need to have that diagnosis confirmed, and I think we need to have at least radiographs to diagnose that, rule out other conditions, rule out neurological conditions, because we've got the potential of making that worse. Some people say, oh, we should reserve it for the older dog, don't use it in younger dogs, but the older dogs have got comorbidities and more likely to have
Mm.
adverse events. So I don't necessarily agree with that. Shouldn't use it in younger dogs, some people say. But, you know, there are some dogs that respond very, very well to it, and they can't tolerate other drugs or non-steroidals, and this may be the only option for them. But it's just not knowing the probability of problems. And we're only going to know that through more research and collecting data and reporting. And that's why we need to make everybody aware of the potential problems, and if they see that, to report it, so that we can get a better, more generalized picture. I was speaking at a conference last week, and I touched on, I showed that presentation that I've showed here, but before I started that, there was about 100 primary care veterinary surgeons in that conference, and I asked for a show of hands. I said, who has got concerns about adverse events related to Librela? And I guess about 10 people, 10% of
Wow.
that audience raised their hands and said that they had concerns. So there's a lot of, and there's vets that I talk to that say, I've never seen a problem, never seen a problem. So yeah, my population of animals is skewed, but it's still significant.
Yeah. This is the tricky area now, is that, you know, that percentage of dogs that do really well on this drug, that it is the only thing that's making a difference for them. Do we really want to take that away from those dogs? But at the same time, we're weighing that against, essentially, in my mind, these are lives lost in a horrible way. They did not need to progress this way. And they've gotten to a point where there are no good options. There are no more good options. There's no more managing the pain
Yes.
that they're experiencing. And so that's a really tricky scale to balance on. So yeah, I don't know. What is the right response on this? What is the right direction to
Yes.
take into the future? Yeah.
I mean,
Um,
the only guaranteed way of not causing side effects is to not give it.
to not use it. Yeah. So are
And
owners appropriately educated, Andy, in your experiences? The owners that come to you and they have these side effects, did they know that they were a risk to begin with when they
no,
started with this drug? Because that to
no,
me is a huge issue. These owners are doing the best thing that they can, on the advice of their veterinarian, and they have no idea of the risks that they're running. They don't know that they're supposed to be pushing for screening. They don't know that they're supposed to be monitoring for these things, because they think that this is safe. There's no risk involved. That's very much been my perception of the owner understanding and owner education. And I think that is something we can do something about. I think every owner that is opting into this treatment should be well aware of the potential risks that they're facing.
and maybe they should be signing written consent to use it, you know.
Yeah. Okay.
But yeah, it's difficult because the first question the owners asked you is, what are the chances? I can't tell you that. In my experience, you know, it's very, very high, but I've got a skewed population that I'm seeing. But the true incidence, we don't know. So it
We don't
is a
know.
bit like playing Russian roulette, but you don't know how many bullets are in the gun, and it
So
might be fully loaded.
how do we solve that problem? How do we actually get non-skewed statistics on the incidence of adverse events? Does Zoetis hold that information? Because adverse events are reported to them, and they also know how much of the drug is being used. Do they hold that information? How do we get an unskewed, idea
So
of the actual prevalence?
I mean, all of that information is passed on to the VMD in this country and the FDA in the USA. Like, that is a legal requirement that any adverse event that's reported to Zoetis must be reported within 28 days to the VMD. So, I mean, I've been in discussions with the VMD and Zoetis, and I've looked at their reporting systems, and they could be better, but that is, that's not the drug company's fault. That's just the system that's being used. And I think it's important that as much information is given as possible. So actually phoning Zoetis or the VMD to give that information and give as much information as possible when you are seeing a potential adverse event, and that includes lack of efficacy. So if it's was working and is now not, or didn't work from the get-go, that that should be reported for sure. And only until these cases can be reported, investigated, and certainly, the VMD has just last week updated their recommendations and what to, and they have recommended that appropriate diagnostic imaging is done prior to administration to confirm the diagnosis, and then serial radiographs to monitor. But then that goes back to the primary care vets that then have got to speak to the owners and say, hang on a minute, we need to sedate your dog again. We need to take x-rays at your expense to, monitor for any problems on this drug. And that's difficult. That's a difficult conversation. And, a lot of people aren't going to be able to afford to do that.
Yep. Yeah, and that to me is really part of the decision making that needs to happen for an owner. They need to take that into consideration. If we use this drug, then the best thing to do is that we are having x-rays at least every 6 months. That's a lot of x-rays to commit to. For the rest of my life, this is what we're doing. They should be seeing a rehabilitation therapist regularly so that we can monitor strength, neurological function, and joint health throughout the body, because we can see and feel those changes. Like you said, you can feel those changes within the joint, and you'll be able to feel that, especially if the dog is not showing signs of pain. We can pick that up on a manual assessment. That should be part of the like the decision making process. But it definitely feels like this is given, like many other drugs. If we're giving this and the pain is under control, then we don't need to worry about the rest of the things. We don't need to worry about regular rehabilitation or physiotherapy, because that's an additional cost and it's additional thing to manage. So I think that's I think from my perspective, I think that really that's the area where we can make a difference right now, is in owner education and having them truly understand, from our perspective, what could go wrong and what can we do to prevent that. And the decision to use the drug or not use the drug should be theirs, but they should do that with as much knowledge as we can give them. Yeah.
And support. And I think, physical therapists are in a fantastic position to monitor for change. And if you know what to look out for, it's very easy to spot that, things are not going according to plan. And then, you can flag that with the veterinary surgeon to prompt further investigation.
Okay, Dr. Andy, thank you so much for this conversation today. It's been a really good one. We've had amazing comments. I know that we didn't address all of them, guys, but thank you for joining the conversation. It's been really good to have you here. Thank you.
Thank you.